Hello, everyone. How you doing? Grant, thanks for letting me present. Really appreciate it. Like it says, my name is Brad Conlan. I'm the CEO of Bimini Health Tech. We're a medical device holding company. We have products in aesthetics, breast reconstruction, and orthobiologics. So when I was making this talk, I thought, when we're talking about fat, I pulled an ad from 15 years ago. And at its core, this is really, it's old, or old school as I put down there, AKA. But this is really kind of what we're still doing. And I think the GLP phenomenon and addressing the deficits created by that, especially in the face and other parts of the body, at least the fat portion can be addressed with fat transfer. And I'll talk to you today about our particular version of two different products we have on the market and coming to the market. On the left-hand side, we have Dermapose, which is a small volume product that actually has a lipo component. And on the right, PureGraft Sync, which is a large volume product for the breast and buttocks. Dermapose Access, which is the lipo portion of what we developed. Long story short, it's liposuction training wheels. Now, the plastic surgeons in the office may not find a lot of utility in something like this, but derms or people in the PA setting, maybe they will. Basically, we're able to harvest fat through a needle puncture and deliver a cannula through the inner diameter of the needle. So there's no scalpel, no stitches required. This is an example of how it works. This is a sterile, FDA-cleared product to make lipo easy. Sometimes it's better just to show a video. The product attaches to wall vacuum or a pump, lifts up the subcutaneous space. Needle is actually punctured, and the cannula goes through the center of the needle. Dermapose Refresh. Now, once you take the fat out, you actually need some sort of utility to actually size the fat and make it injectable. In a few slides, I'll talk to you about shear and why we think sizing actually matters for whole fat. This product is interesting from our point of view because it's a syringe within a syringe. Now, if you want to waste a lot of money and spend a lot of time in engineering, design a square syringe. This was tough, to say the least. But what it is it's fat sizing built into a device. With a single pass, you get homogeneous injectable fat. If you go back and forth, you actually break the fat up more and has nano-like characteristics. And what you end up with is a 10 to 30 cc injectable. So this kind of shows how it works. As you press down, there's sizing. The technology, it can work, frankly, with the addition of a PRP at the surgeon's discretion or any other stromal vascular fractions or tissue you want to put in there. So you can see in real time, at the bottom, what's left over is actually free lipid and gunk you don't, frankly, want to put back in the patient. And what you can pull back out is nice, homogeneous, yellow tissue for injection. Throw a little bit of engineering at you today because it's before lunch, and of course you want to hear about engineering. Shear matters. So as you move from gauge to gauge to gauge, an 18 gauge needle is 800 microns. 21 gauge has 4 times the shear stress on the fat. 25 is 35 times. 30 gauge is 153 times. So from our point of view, 21 gauge is a specific sweet spot where the tissue is still injectable, but sized to a place where you will actually get really good in incorporation. Moving to large volume, this is a new product. It's under FDA review. It was submitted in Q4, and this is for large volume fat transfer, moving 500 cc's of tissue from where you don't want it and putting it where you do. You know, having acquired PureGraft about 10 years ago, we always heard two things. Hey, it's hard to use because liposuction's tough, and can't you put it in a syringe? So really, it may be a decade later, but these two products address the shortcomings of what we believe is still a great product. So it comes pre-assembled. There's no reusables. You take it out of the box, you plug it into the wall vacuum, and you immediately, as you start liposuctioning, the product is actually filtering in real time the tissue all in one place, as you can see on the left. Then what you pull out is a single-use PureGraft bag, which you can pull the tissue out and inject where you like, all in real time in any setting you see. So it does have all the same features and benefits: single use, fully disposable, 500 cc's of fat, and has proprietary technology, so it actually processes up to 3 times faster than the current PureGraft system. So you can get 500 cc's in less than a few minutes. So fat, I know, is a big deal. We've been talking about it a long time, but the market's slow to adoption because how do you monetize fat as a company and a physician? But it's turning. I think I want to end on this, that there are some real interesting realities coming to the market. The reimbursement coding has changed on fat. A few years ago, you would get a stock $500 code that paid for the technology, but here's what changed. It's now $619 for small volume fat, and you get another $190 for every 25 cc's you put in. Here's why that matters. The more fat you put in, the more reimbursement you get. Same thing on the large volume side. Code is 604, and for every 50 cc's you put in, you get over $190. So the market and the reimbursement actually is moving towards fat, and the amount of money you can reimburse either in your surgical setting or even your private practice, if you're able to use reimbursement, can be really valuable to you. So thank you for your time.